Let's tackle a common question. How can you tell if you have a brain tumor? Many people assume it starts with headaches. While possible, that's not the typical first sign. In fact, it's quite rare for headaches to be the primary symptom. Headaches generally occur when specific things happen, like when a tumor starts bleeding internally, rapidly increasing its size. Another situation might be significant swelling around the tumor, or when the tumor blocks cerebrospinal fluid flow, leading to fluid buildup, a condition known as hydrocephalus. These types of headaches tend to be quite distinct. They often appear during the night, especially when lying down, because that position increases intracranial pressure. Many patients describe being woken up from sleep by the pain. Nausea, vomiting, and sometimes double vision might also accompany these episodes. This isn't your usual tension headache or occasional migraine. It's a very specific kind of discomfort. Incidental tumors. On the flip side, many brain tumors show no symptoms at all when discovered. These are known as incidental findings, tumors found accidentally during brain scans done for unrelated reasons. Maybe the person had a car accident, a fall, or was being examined for Parkinson's, breast cancer follow-up, or another condition that led to imaging. So what happens when you find a tumor you weren't even looking for? That opens the door to some challenging ethical and medical decisions. Should you treat it right away? Should you monitor it first? In many cases, these incidentally found tumors are small, benign, and slow-growing. They might never cause a problem and can often be observed over time with periodic scans. If they stay stable, there may be no need for surgery or other treatments. Seizures. Now, among symptomatic tumors, seizures are a more common early clue than headaches. The type of seizure often gives a clue to where the tumor is located in the brain. Tumors in the occipital lobe might trigger visual disturbances or visual seizures. If located near the motor cortex, the person might have motor seizures, twitches or jerking in specific parts of the body. In the speech center of the brain, seizures could interfere with language or speech fluency. Tumors in the temporal lobe can produce complex partial seizures, episodes that are sometimes mistaken for strange behavior or emotional disturbances. In fact, some individuals experience abdominal epilepsy, where seizure activity causes stomach pain, leading doctors to mistakenly think it's a digestive issue. Seizures can also appear as momentary blank stares, or even cause temporary paralysis, numbness on one side of the body, or vision loss in half of the visual field. Final thoughts. To wrap up, brain tumors may become evident through four main paths. No symptoms at all, discovered incidentally on scans. Neurological deficits, such as vision, speech, or motor changes. Seizures, often unusual in presentation, depending on the tumor's location. Headaches, but usually only when there's increased pressure inside the skull.